Hi, I'm Tom Bagwell, and welcome to Hello Health, a partnership with the Ochsner Health System and Humana to bring Ochsner's Hello Health weekly education and information series to you. Our topic this week, stroke. Our guest is neurologist Lauren Dunn. First, some background. Dr. Dunn was born in New Orleans, but grew up in Houston. She received her undergraduate degree in English from Yale University. She attended medical school at Baylor College of Medicine in Houston. She completed her internship in internal medicine and residency in neurology at Columbia University, New York Presbyterian. Dr. Dunn completed a fellowship in vascular neurology at Johns Hopkins Hospital. She is board certified by the American Board of Psychiatry and Neurology, and it is our pleasure to welcome Dr. Lauren Dunn to Hello Health. Good to have you with us on the program.
Thank you for having me.
Thanks for being here. So you are a believer in the Oxford comma?
Yes, I do enjoy punctuation.
Good, excellent. And patience?
Yes.
Do you remember what was it or who was it that first got you interested in medicine, and how did you end up in neurology?
I actually didn't make that decision until I was in college. I was taking science classes and English classes and really enjoyed the science of things, but missed sort of the patient interaction that comes with just science bench work. So medicine felt like a good marriage of those two interests. And my love of English and literature also takes a role in neurology, as I get to study how the brain works and different language functions as well.
What do you think you would have done with the English had you headed in that direction?
I don't even know.
Classroom somewhere?
Didn't be in a classroom, or maybe working in publishing, something like that.
Well, we're glad, and I'm sure Oxford is glad that you went the direction in which you did. Let's start with the medical definition of stroke. So what is a stroke?
So a stroke is clinically characterized as the rapid onset of neurological symptoms that come from some damage in the brain. And I like to remind patients that it's similar to a heart attack. So one nickname for stroke is a brain attack. And there are actually two kinds of stroke. The most common kind is called an ischemic stroke. That occurs when there's a blockage of blood flow to part of the brain, and that part of the brain is damaged because of lack of oxygen and nutrients. A hemorrhagic stroke is the second type, and that's caused by a ruptured blood vessel and uncontrolled bleeding in the brain.
So the two are different. How and what triggers them typically?
So they are different in the mechanism and also the treatment that occurs once they happen. Clinically, they present almost identically in many cases, so we really don't know which kind of a stroke you're coming in with until we're able to get imaging in the emergency room. Ischemic strokes are typically caused by blood clots that block one of the blood vessels in the brain, just like a clog can block water flow in one of your pipes in the bathroom. And a hemorrhagic stroke happens when you have uncontrolled blood pressure or other factors that cause a small blood vessel to rupture.
We know how common heart attacks are. How common is stroke?
They are extremely common. They occur in almost 800,000 people a year in the United States. They're also a major cause of long-term disability in the United States. Unfortunately, strokes are also the fifth leading cause of death, behind other things like heart disease and cancer. Important to me is stroke impact on women, and 60% of people who die from strokes are women. So more women are dying from strokes. And most people don't realize that young people can have strokes. Up to 1/3 of strokes actually occur in people less than 65 years old.
Been any research on why more women die? Is it just that they're maybe more reluctant to go get care?
Well, it's multifactorial. Our risk of stroke increases as we age, and there is a larger population of older women alive, so they tend to be more afflicted by stroke in their older years.
Okay. What about in Louisiana? Stroke higher here?
So unfortunately, Louisiana falls into a high-risk part of the United States, the southeastern United States, which has been dubbed the stroke belt. And we see a higher incidence of stroke in this region, and that's probably due to higher cardiovascular risk factors in our population, like high blood pressure and cholesterol, and also our dietary culture in this region.
Stroke belt, cancer belt, too many belts.
Yes.
Here in Louisiana. Let's review the signs of stroke.
Okay. One mnemonic that I like to remind patients of is FAST. So if you remember the phrase FAST, it will help you remember the symptoms of stroke. F stands for face. So if someone's face looks droopy or twisted on one side, that could be a sign of stroke. A stands for arm. If when you ask your family member or friend to hold their arms out and one arm drifts down, that's a sign of weakness in the arm, and that could indicate a stroke. S refers to speech. Speech can become slurred, garbled, or no speech could be produced at all. And then T is really important. T stands for time, and that's to remind you that if you notice any of these symptoms, it's important to call 911 and get to an emergency room as quickly as possible.
Important point, any of these symptoms, right? So you don't have to pass, if you fail one of the four that you just talked about, it's worth going to
Correct. If you
get emergency
any
care.
of those, come in immediately.
And what about driving to the hospital yourself, if you're by yourself, having a family member drive you versus calling 911 and waiting for an ambulance?
So we recommend in general that you call 911 and wait for the ambulance. They're able to do an assessment and actually call the emergency room before you get there to give us a heads up that a potential stroke patient is on the way, and we can get things ready for you while you're coming.
And if you're in an ambulance, that's happening. They're calling for you too, right? The hospital's
Yes.
waiting. Dr. Dunn has brought along a patient testimonial. This is the Ochsner production team and Dr. Dunn, so let's take a listen to this story.
Came home from the gym and noticed a tingling in my hand. Went to talk to my wife to say I had a tingling in my hand. She says, your speech is real slurred. She says, you must be having a stroke. So she called 911. I quickly took an aspirin. The EMS got there, checked me out, evaluated me. Got to the main clinic, and they jumped on it real quick. I mean, it's just amazing how fast everything was set up and ready. They rolled me in real quick, very, very fast, took a CT scan of my brain to make sure I didn't have a brain bleed, and then started the clot buster process, and got me going pretty quick on that. A little bit later on, probably about 28 hours after I went into the Ochsner, to let me go home. The care that Ochsner took of me, that I'm still able to do everything I do. You know, I'm able to drive, I'm able to work, I'm able to function completely, play golf, enjoy my grandkids, take care of my garden, and just all the things, the fullness of life that I have. So I'm very thankful for that, and I just thank God that He put me in the right place with the right people to take care of me.
And still doing well today.
Doing very well, yes.
Important point to make. So immediately he took an aspirin. Sometimes that can be a good idea, other times not. Can you explain why?
So I know people have heard that if they think they're having a heart attack, chewing an aspirin is something they should do immediately. We don't recommend that in stroke because when you have symptoms, it's very difficult to tell if they're symptoms from an ischemic stroke or a blockage or a hemorrhagic or bleeding stroke. And if you have a bleeding stroke and you take an aspirin, that could make things worse. So we recommend just calling 911 and we'll take it from there.
Okay. How is stroke treated, and what role does timing play in all this?
So timing is really important. The sooner we can get treatment to you and either remove or treat the blockage, the more brain we can save. Something we like to say in neurology is that time is brain. So the sooner you get in, the more we can do for you. We have two types of acute treatment. The first is an IV medication. It's sort of a clot-busting infusion that is able to break up any clot and reduce disability in patients who have a stroke. That medicine is called TPA, and you're a candidate for that if you're having an ischemic stroke and you arrive to the hospital within 4.5 hours of when your symptoms started. The second kind of treatment is called a thrombectomy. That's actually a procedure where an interventional doctor goes in through a large vessel in the groin, snakes a catheter up to the brain, and is actually able to physically pull out the clot that is causing the problem. Our guidelines are a little bit longer for that one. In certain cases, we can treat you up to 24 hours after your symptoms started.
These clot buster drugs, how long have they been around? And really people look at them as miraculous.
They are. They've been around since the early 90s, and they're our mainstay of stroke treatment. And if you're able to get to the emergency room in time, then we try to get that drug into you as fast as possible.
Are there some hospitals that are more prepared to deal with stroke victims? And can you talk about what's available at Ochsner?
Sure. At Ochsner main campus, we are a comprehensive stroke center, so we're able to offer acute treatment therapies like TPA, which is the clot-busting medicine, and thrombectomy. Not all hospitals offer thrombectomy, so if you present to another hospital and we think you're a candidate, we will as quickly as possible bring you to Ochsner for a thrombectomy. But other hospitals in the community are able to give the clot-busting medicine TPA, and we rely on EMS and the emergency system to triage you to the right hospital when they notice you're having stroke symptoms.
So I'm thinking to myself, okay, if I'm a high-risk stroke victim, maybe I need to be looking at these things ahead of time to make the right choice. What would be someone who would be a high risk?
So a high-risk patient is someone who's already had a stroke. That certainly increases your risk. Someone who has had heart disease also probably has some vascular disease in the brain. And we're going to talk about two very high-risk conditions a little bit later, atrial fibrillation and carotid stenosis.
That's coming up. Let's look at a thrombectomy before and after. And Dr. Dunn's brought along some images, so let's look here.
So in the image on the left, you can see that there's the abrupt cutoff of a blood vessel that is supposed to be snaking over to the left side. And our technician, an interventionalist, was able to go up with a catheter and a small tool and actually pull out that blockage. And you can see blood flow to the distal or further out segments of that blood vessel was restored in the after picture. So that's a successful outcome after thrombectomy from a radiographic standpoint.
The hope is that a patient gets to the hospital or an emergency care treatment center quickly, but that unfortunately is not always the case. What is realistic expectation with stroke recovery?
So the good thing about stroke is that most patients who have a stroke can expect some improvement. Not all patients recover 100%, but we do see most patients recover some of their strength or other weakness, deficit, etc. after they have a stroke. What's very frustrating to patients and providers is that recovery is a very slow process. It can take weeks, months, even sometimes years in some cases for recovery to take place. Almost all of our patients after a stroke receive some sort of therapy, either inpatient or outpatient, physical therapy, occupational, and speech therapy. And one important thing to keep in mind is that depression affects a large percentage of stroke patients. And it's not uncommon to have some mood symptoms after a stroke, and addressing those can actually improve outcome as well. And as I mentioned before, if you've already had a stroke, you're at higher risk for a stroke. And if you already have deficits from the first stroke, then a second stroke will only likely increase your disability. So it's important to control those risk factors.
Follow up to one of your earlier thoughts about brain cells dying and how quickly that takes place. What's the difference between brain cells dying when I have way too much to drink and brain cells dying in a stroke? Because it seems to me that those brain cells recover.
So
some might argue, but yes.
Yeah, so in a stroke, we typically see the death of millions of neurons or brain cells. And it's a significant part of your brain that we can actually visualize on an MRI. When you have more generalized unhealthy brain behaviors like drinking, we don't pinpoint specific locations of brain death or shrinkage unless you're a chronic drinker, and then we can see some areas of atrophy. So a stroke is a very targeted area of pretty significant immediate brain death.
Good answer. Can stroke be prevented?
The great news about stroke is that it can be prevented. We recommend talking to your primary care doctor about the ABCs of health. A is aspirin. It's a good stroke prevention medicine. If it's appropriate for you, ask your primary care doctor.
This is a daily dose, 81 milligrams.
Generally, 81 milligrams is adequate,
Okay.
yes. B is for blood pressure. High blood pressure or hypertension is the most powerful risk factor for stroke, and it's important to address that before your blood vessels have felt the effects of many years of high blood pressure. C stands for cholesterol, getting that cholesterol controlled, and also another significant reason that I think we see more strokes down here in the southeastern United States is smoking. So getting off the cigarettes, encouraging your family members to stop smoking, that will do wonders for your stroke prevention.
Outside of those, are there any other lifestyle issues we should be looking at in stroke prevention?
Yes, so for your overall cardiovascular health, which also involves the vascular health of your brain, we recommend a healthy diet. I think we'll talk about that in more detail in a second. Maintaining a healthy weight, staying active, so doing some form of exercise or physical activity on a weekly basis, avoiding tobacco, and then limiting your alcohol consumption.
We talk about diets on this program on a regular basis. Recent program, we talked about all sorts of diets. One that you particularly like, especially in the area of stroke prevention, is the Mediterranean diet. Why is that?
Yes, so the Mediterranean diet has been studied in large groups of people and has been found to reduce the incidence of stroke in populations who adhere to it. So it's a diet rich in fruits and vegetables, and also getting protein from lean protein sources like chicken and fish. And also remembering that there are healthy sources of fats in the Mediterranean diet that are good for our heart and brain health. So fatty fishes and avocados, things like nuts are all sources of healthy fats that are important to our health as well.
And this is something you believe in it. and you actually follow it, right?
I do try to follow the Mediterranean diet, yes, and luckily we have a lot of delicious seafood in this area, so I think we can integrate it really well into New Orleans culture.
All right. Our guest this week is neurologist Lauren Dunn, and we're talking about stroke. Let's talk about people with atrial fibrillation or AFib. Are they at higher risk of stroke, and if so, why?
Yes. So atrial fibrillation is an irregular heartbeat that is seen in more people as they age. It's related to stroke in that when the heart squeezes irregularly, clots can form in the heart that then get pumped out to the brain and can cause strokes. So if you have a diagnosis of atrial fibrillation, you should ask your doctor, your cardiologist, what am I doing to prevent strokes from happening in this condition? The mainstay for treatment for stroke prevention in patients with AFib is a blood thinner, also known as anticoagulation, and that prevents those clots from forming in the heart in the first place.
What about carotid artery disease?
So carotid artery disease is another high-risk condition that can lead to stroke. It involves the deposition or collection of plaque and gunk in the large carotid artery in the neck. And if that plaque becomes big enough, then pieces can break off and the plaque can rupture and cause a stroke. It can also cause the blood vessel to get so narrow that hardly any blood flow can get through to the brain, and that can also lead to a stroke.
What about plaque forming in other areas of the body and then maybe leading up to there?
So yes, we can also have plaque formation in blood vessels that are actually in the brain. So the carotid is in the neck, but blood vessels in the brain themselves can also develop plaque and can become very narrow and can also have plaque rupture.
And you mentioned people with heart disease are at higher risk?
Correct. So the process of plaque building up in our blood vessels is something that happens probably everywhere from a young age. And if you have plaque buildup in your heart leading to heart disease or a heart attack, there's a good chance that the rest of your blood vessels have also been impacted, and that could mean you're at higher risk for stroke.
Would that be the same case with diabetes and obesity?
Yes, so diabetes just accelerates the deposition of fat and plaque in the blood vessels, and obesity also is associated with that same cardiovascular risk.
We've scared people to death, hopefully not to death, but we have certainly warned people. But I know you want to provide the hope, right, that there are things, and we've talked a lot about them tonight.
Yes, so we believe a lot in stroke prevention, and a lot of that doesn't happen in the neurologist's office. It happens at home and with your primary care doctor. So seeing your primary care doctor at least once a year to get the blood pressure checked, check the cholesterol, to review your risk factors for stroke, and to get those under control before it becomes a problem. The more people we tell about stroke, the more people we can help. So we encourage you to spread the word among your friends, form exercise groups, tackle these risk factors together. It makes it a lot easier. For patients who have already had a stroke, they also need to look at their risk factors and do what they can to get those under control so they don't have a subsequent stroke. We have clinical trials, including many going on at Ochsner, that are looking for ways we can improve outcome after stroke, how we can intervene on stroke earlier, and how we can prevent stroke to begin with. I'd like to remind everyone as well that we have stroke support groups all over the state that exist to help stroke survivors and their families deal with all of the challenges that come with living a life post-stroke.
Yeah, that's a good point, because you talked about one of the biggest challenges is depression. But beyond the support groups that may be outside of the home, talk to me about how family members can be helpful, spouses, siblings, for people who've had strokes before, and what you encounter on a daily basis working with patients.
So one thing I've noticed is that if everyone gets on board with Mediterranean diet, exercise, quitting smoking, then it's much easier for the patient to be successful. It's very hard to go home with all of these new recommendations and have your family members pulling out the fried chicken, smoking in the house. Your likelihood of succeeding is much lower if no one else is shooting for those goals with you.
And what about patients? So somebody who used to be able to solve a crossword puzzle like this or have a conversation may have challenges now. From someone who's on the other end, what advice do you have?
So from seeing patients from the very beginning to many years out, the advice that I give you is to be patient and to persevere and know that changes happen slowly. The brain is a very complex organ, and its recovery is very complicated, but you don't understand all of it. And it takes months and sometimes years to really recover function. Sometimes you don't recover function. But what's important is preventing another stroke, staying as healthy as possible, and really maximizing what what functional abilities you have left.
Can you tell me what would happen with a therapist working with a stroke victim? What sorts of exercises, that sort of thing?
Yeah, so therapists are really instrumental in stroke recovery. They work on targeting muscle groups that are weak after a stroke. Speech therapists work on swallowing and also speech production and comprehension after a patient has had a stroke that affects speech. And therapists also teach you how to compensate for your deficits. So how to use other forms of communication to get your point across or to interact with the world, how to use your strong side to help do everyday tasks.
All right. Earlier we talked about diet and the Mediterranean diet. We have some more diet tips for you. We started a new segment on this program. It's with Molly Kimball of Eat Fit, and here it is.
When it comes to salt, most of us are getting way more than we need in our diets. So the Dietary Guidelines for Americans recommends that most of us have about 2,300 milligrams a day. The number's lower, about 1,500 milligrams a day if you're over age 51 or if you're at increased risk for things like high blood pressure or stroke. And here's the thing, most of us get more than double that. So if you're looking to cut back on your sodium intake, there's a few key product swaps, brand swaps that you can make that will slash literally hundreds of milligrams of sodium a day. These are our go-to solutions for our clients, for our Eat Fit restaurant partners that make it easy to slash that salt while keeping the flavor. So for Cajun seasonings, our top pick is Chef Paul Prudhomme's blackened seasoning blends. There's a variety of different options there, but they're mostly about 100 milligrams of sodium per serving. Compare that to over 300 milligrams of sodium for most popular Cajun seasonings, and it's a giant salt savings. Salad dressings are a really sneaky source of salt. Even those that taste sweet can have a lot of hidden sodium. So one of our favorite brands is Hanley's. They're a local company. They're based out of Baton Rouge. We like it that they're a clean ingredient list. It's ingredients that we would actually have in our kitchens to make our own salad dressing. They're low in added sugar, and the best part is that they're also lower in sodium than most other brands you'll find in stores. And our choice of hot sauce matters too. So our favorite there is Tabasco. It's only got 35 milligrams of sodium compared to something like Louisiana hot sauce, which has 240 milligrams. So again, that one brand switch, that one product swap, huge savings. So the bottom line is that with just a few key behavior changes and product swaps, we can easily slash thousands of milligrams of sodium from our diet.
Wonderful tips from Molly Kimball. By the way, you saw a package of goat cheese there, and Molly wanted us to know goat cheese is a great alternative if you're a cheese lover. We are in our family. Thank you to Molly. Difference between a TIA and a stroke. And we haven't talked about what a TIA is yet.
That's a great question. A TIA stands for transient ischemic attack, and it basically is a stroke that tried to happen. It happens by the same mechanism as a stroke, but for whatever reason, the brain or the body was able to clear that little blockage. There's no permanent symptoms and there's no damage to the brain as we can see on MRI.
What would the symptoms be of someone having, or could we have a TIA and not even know it happened?
So you could have a TIA and not know what happens. Sometimes people ignore mild symptoms that go away, but the symptoms of TIA are the same as stroke. So that's why we recommend you, if you have any symptoms, like we mentioned with the fast mnemonic, you should get to the emergency room as soon as possible, even if they go away or if they're coming and going.
The other point I want to follow up on earlier, you said if we can get to it within 4.5 hours. That sounds like a long time. But what advice would you have and warning would you have for people who are saying, you know what, I heard the doctor on the TV program, she said 4.5 hours. Let's just wait this thing out and see what happens.
It's a very small window of time. A lot of things have to happen. You have to get to a facility that's able to give you the medicine. We have to do some scans, make sure your blood pressure is within the right range, and the time goes by very quickly. We also know that TPA is more effective the earlier we give it. So we can do more and really maximize its potential the sooner we give it to you.
All right. Last thing we want to review, easy to remember keys to recognizing stroke.
Yes, if you take one thing away from this talk, it's FAST, which is the mnemonic to help you remember the symptoms of stroke. F for face drooping or weakness. A for arm drift or weakness. S for speech, which can be slurred, garbled, or no speech production at all. and then T for time, to remind you to call 911 as soon as possible because time is extremely important.
Excellent program. I'll take away lots from this. Thank you so much.
Thank you.
Dr. Lauren Dunn. I want to thank Dr. Dunn for the education and information she has provided and for her work in the Ochsner Health System. To make an appointment with any of Ochsner's physicians, including this week's guest, or to register for any of Ochsner's Hello Health seminars, you can call Ochsner at the number you see on your screen or send us an email. Here's our address. We'd love to hear from you. hellohealth@ochsner.org. As a reminder, you can re-watch this week's presentation and many of our other Hello Health programs on Ochsner's website at ochsner.org. Just type Hello Health in the search box and that'll get you started. Thanks again to this week's guests. Thanks to Humana and Ochsner for making this program possible. And our final thanks, as always, is to you for your support of this program, Hello Health. I'm Tom Bagwell, and we'll see you next time.